Hi, my name's Sophie and I'm going to walk you through the hospital outlining your journey from admission to discharge. Before you arrive at ITEC, your doctor will make your booking with ITEC Day Surgeries and provide you with any pre-admission and consent forms you may require. Please ensure that you fill out these forms and return them as soon as possible so that we can prepare for your admission at ITEC. Please be sure to also confirm your level of cover with your health insurer and make sure that your contributions are up to date. You also need to arrange a carer to come and collect you from ITEC post-surgery by private transport and also stay with you for 24 hours post the surgery. One of the nurses will call you 1 to 2 days before your surgery to inform you of arrival time and any fasting requirements. They will also ask you relevant medical questions, including past illnesses, hospital stays, and any current medications that you are taking. The average length of stay at ITEC is 3 hours post the arrival time that we give you. When you arrive, please make yourself known to one of the friendly reception staff. Here, they will check your details and make sure all the correct paperwork have been filled out. They will also ask you for the first time your name, date of birth, and surgery site. They will continue to ask this throughout your stay at ITEC to ensure that the surgery that you receive is what you are booked in for. At this stage, they will also inform you of all your rights and responsibilities as a patient. Shortly after your admission, one of the preoperative nurses will help you in preparing for your procedure. They will check your blood pressure, heart rate and temperature, as well as administer any eye drops that you require. You will then be taken to the dilation lounge to allow for those eye drops to become effective. It takes an hour and a half for your eyes to fully dilate, so your wait time allows for this to happen. Even if you do not have eye drops, you will still have to wait in the dilating lounge. Once your eyes are fully dilated, your anaesthetic nurse and anaesthetist will come and see you. This is where you have the opportunity to voice any concerns or questions that you might have. They will then ask you any further relevant medical questions and once again ask your name, date of birth and surgical site. It is here in the anaesthetic bay that you will be made comfortable for the next 3 stages. Your anaesthetist will provide you with the appropriate level of anaesthetic for your surgery, and once they are sure that the anaesthetic has taken effect, they will take you into the operating theatre. This is the operating theatre. It is here that you will have your operation. Along with your surgeon and anaesthetist, you will have 2 experienced nurses with you at all times. Your eye will be cleaned with antiseptic, and then a light paper drape will be placed over you during the surgery. This is to keep the instruments and the area sterile. You will have a small oxygen tube sitting under your nose that will have a gentle stream of oxygen blowing through whilst you are under the drape. During the surgery, you might hear voices from the surgical team as well as other noises. Don't panic, this is normal through your twilight sedation. Once your surgery is finished, the drape will be removed and your eye will be covered with a pad or eye patch. Once this is finished, you will be taken into the recovery area. After the operation, this is the recovery area. In most cases, you will stay here for about 10 minutes, depending on the surgery that you have. Your anaesthetic is a type that the recovery and wake up is quick. Once the recovery nurse is satisfied that you are fully recovered, they will assist you into the discharge area. A nurse will monitor your progress, and once you are fully recovered, you will be offered a light refreshment and beverage. After anaesthesia, we require you to be taken home by a responsible adult in a private vehicle and for an adult to stay with you for 24 hours post-surgery. When you are ready for discharge, the nurse will provide your carer instructions to the discharge lounge. Before you leave, both you and your carer will be given written and verbal instructions for post-operative care and your post-operative appointment, usually a day after the surgery. You will also be given an ITEC patient survey form to fill out at home. Evaluation of patient surveys allows us to implement appropriate changes to improve our service offering. Patient satisfaction is an important indicator of our success, and we value your feedback.